This is Pet Life Radio. Let's talk pets.
In the world of contemporary veterinary medicine, Julianne Lee is one of its heroes. She's been on both sides of the medical practice fence, spending her first few years working through conventional allopathic medicine and then crossing over into a holistic approach. It was a near-death experience that brought her there, and we'll find out all about it when we return from a short break from our sponsor. You're listening to Bark and Swagger on Pet Life Radio, and I'm Jody Miller-Young, your host. So grab that favorite beverage, get comfortable, and we'll be right back.
Pets are part of the family. Make sure you can always afford the quality health care they need with Easy Pet Check, a nationwide pet insurance alternative. With Easy Pet Check, you'll save up to 75% on all your pet's health care at any licensed veterinarian in the U.S. Easy Pet Check accepts all dogs and cats regardless of pre-existing conditions. Visit EasyPetCheck.com. That's the letters EasyPetCheck.com. Taking care of your pet can be easy with Easy Pet Check.
Let's Talk Pets on PetLifeRadio.com.
Welcome back. If you've just joined, you're about to meet Julianne Lee, who opened the first completely holistic clinic in Canada and one of the first in North America. She's founder of the beautiful pet product brand centering on gut health called Adored Beast, and she's a friend to Bark and Swagger. I'm really pleased to welcome Julianne Lee. Hi, Julie.
How are you?
I'm good. How you doing?
Good. Busy
Awesome.
like usual, but good.
Oh, well. Life is just, the days are too short, right? We need more hours in the day, but we fill them, of course. So I'm sure people are really anxious to hear what kind of near-death experience got you from conventional medicine to holistic medicine. Tell us about that.
Well, there was two, really. One with myself, which was when I went to, I'll start at the very beginning. My dog, who developed cancer at 4 years of age.
Yeah.
I was already raised very holistically, but then I went to school, and when you work that hard, either you're going to follow and dig into the philosophy that you're learning, or it's very hard to be there if you're not believing what you're learning.
Of course.
So I kind of jumped the fence from holistic to conventional. And during that time, my dog got really sick towards the end of I was probably in that realm for about 8 years, I guess. And my dog got cancer, and back then, this is what you did, and like very strict protocols. So I decided that I was just devastated. I went to my mom and I said, I don't know what to do. I'm so torn. And she said, you do. Call Virginia, who was our holistic practitioner for our family. And I did. And she just, right away stopped giving him that food, get him back on like a raw food diet or a more species oriented diet. Don't let them take a biopsy, take them to, so I went and saw an internal medicine specialist. They said to me that his prognosis was very guarded, because if I was going to do surgery, I was going to do the best. So I went to a board certified internal medicine surgeon, and he was going to remove it. But what was going to have to happen, it was very invasive, and he was going to have to actually resect some of his intestine. So it was like I said, it was very guarded, and I couldn't get in for 2.5 weeks. So those 2.5 weeks, Virginia started working with them, and we were doing, SEX suppositories and homeopathic medicine. And by the time I took him back, it was incredible. He called me. I had gotten a hotel, and I thought my dog had died, because he called me in fairly quickly, like wasn't hours of surgery like we thought it was going to be. And he said, I don't know. It was Dr. Smith. He was just amazing. He said, I don't know what you're doing. And I don't even know if I want to know. Because this was like 1991. And he said, but whatever you're doing, keep doing it. Because this tumor was completely encapsulated and probably a quarter of the size that it was.
Oh, wow.
It was incredible. Don't have to resect anything, la, la, la. So took him home. And once he recovered, I had to make some big life changes of what I wanted to do. And I felt that at that point, I wanted to get out of veterinary medicine altogether, because I had also done some equine work at Humber College and thought, oh, this will be nice. It's just all about fertility and doing fertility and ultrasounds and things like that. But it was equally as depressing for me what they were doing in order to get these horses pregnant. Mm-hmm. So I decided to go to Europe and visit a friend. And when I got there in Spain, she lives in Spain, I got very sick, went to the hospital, and it was like an inflammatory bowel disease, sort of like a hemorrhagic gastritis, which is what I got when I was quite sick. Like if I was really stressed, I would get it. And I thought, there goes my vacation, my sort of reprieve of deciding what I wanted to do. And they put me on fluids. They asked me what was wrong. I basically told them the story, and they sent in a homeopath to treat me.
I get goosebumps because this is what you want to happen.
And I'm looking at him going, just give me drugs. I'm in Spain. I don't even know how to speak the language. I was terrified. I'm like, because we weren't really familiar with homeopathy. We were really familiar with alternative herbs and diet and food and nutrition that way, but not homeopathy. So usually I was sick for, 10 days to 2 weeks because I got really anemic from it. And after clip up 2 to 4 days, I was backpacking again.
Oh my goodness.
Yeah, it was incredible. So once I got home, I just decided that that's what I wanted to do. I wanted to do homeopathy, but the only schools were in England and that were in English. And I was gonna still go, but I had to put all my animals in quarantine back then. So I don't know. I always say that all my dead animals are around me like angels. And just so happens as one of the professors from England started a school at UBC in Vancouver.
Okay.
So I flew out and the rest is history.
Yeah, absolutely. Because you have had experience in both areas, allopathic and complementary, I need to preface this by saying, I think we can both agree that there's nothing like Western medicine when it comes to emergency room, diagnostics, and things like that. You just can't beat them. But what was your biggest frustrations in working with animals on the conventional side from what you were taught? I think it's important for people to understand.
Yeah, well, it's also important to know that we're coming out with the veterinary line. So I'm definitely not anti-conventional or anti-allopathic. But what I am anti is that I feel like we don't embrace the integrative approach. Because even if you have a broken leg, even if you have an animal in shock, even if you have hemorrhagic gastritis, when you use, especially homeopathy, their recovery to that is exponentially faster.
Right.
And cleaner and healthier and less side effects. And the list goes on and on. I just did want to say something quickly. Like I had like 5 clinics in Vancouver, and one of them was huge. We were a 24-hour practice, and 2 of the vets, I had a holistic wing, and 2 of the vets were actually, before they became veterinarians, helicopter first defenders or whatever they're called, like an ambulance. They started using a product called Traumeel. Have you heard of Traumeel? Okay, yes, so
I've used it.
They put it into the IV. And when they started doing that, they started losing less people with shock.
Wow.
So it was really, really, for them, there was no, does it work, doesn't it work, right? They
saw it.
70% less death rates.
Wow.
So my frustration, I think, is that part of not being open to being integrative. And integrative can mean saying, okay, Mrs. Smith, I understand you want holistic medicine. That's not my wheelhouse. I don't have that in my toolbox, but a really great colleague of mine who I went to school with, that's her forte or that's his forte. Why don't you go there? And vice versa. Someone that's doing holistic medicine that is really has a client that really wants more conventional. It's like share the love, right? Be supportive of each other. I think for the patient, and I think for the patient and for the mental health of a family, because there's nothing worse than fighting with your health practitioner, whether it's your own health practitioner or your animal's health practitioner. There's nothing worse than feeling intimidated or feeling like there's conflict. I mean, this is your health, right? And your animal's health.
Right.
And speaking of that, my dog's barking. He wants to get in here.
Well, I had a foster failure cat in the background over here.
Oh, no. Okay.
Our latest foster failure.
Oh, dear.
Yeah, we're hopeless. Let's go back in time a little bit to your experience of starting this first completely holistic practice or clinic in Canada. What was your most eye-opening takeaways?
On which end? On politically or with patients, or there's been so much.
With the pet's health of the animals that you cared for.
Well, I would say the first 3 years, I got all end stage stuff. So the majority of things that walked through my door were people saying to me, if you can't help my dog, I have to put it down. Or if you can't help my cat, I have to surrender it because we don't have any more money. Or if you can't do this, or we've run out of money, we've just spent $25,000 and he's still in a cone and we can't handle it. So I think the first few years was a really eye-opening experience for me. And I was really lucky because I was able to go to India, and I went to India and trained in India. And I saw things happen in India that I wasn't comfortable with. Like, I was looking at things being treated homeopathically that I really was like, okay, they should be on intravenous antibiotics. And it blew me away because they didn't need to be on that stuff. They recovered with homeopathy. So I think what my takeaway with that is that if you're going to practice holistic medicine, is we really need to not look at it as a trend or a label or a marketing tool or whatever. We really need to, as practitioners, dig in and get as much education, if not more so, than conventional. And if we're not going to do that, then we need to be okay to work with, a human homeopath that has a lot of animal knowledge, or we need to try. My takeaway is that when I started, people thought I flew in on a broom. And now it's like they're bombarded by it. So I think the takeaway is the profession is a little more difficult when you're going to go that route, because it's not just that straight. There's a lot more that you can't do it in 15-minute appointments, right? So you've got to back up and go, am I willing to take half the amount of patients in the day and do what I need to do in order to achieve what I need to achieve? It's exactly like us. Like, how do we go to a doctor and be seen for 15 minutes, and they know what's wrong with us? They don't. We get layers, right? So I would say that when I really dug in, it's like the majority of animals that I saw did not have organic disease. They did not have a disease that came from something else. 90% of what I saw was drug layering. So a disease, then drugs to fix that, to suppress that disease, and then side effects from that drug, and then another drug to that. And by the time I got to them, it would take me an hour just to figure out what was going on with them right from when they first got sick, which is where you have to go.
Yes. Well, the tenets of homeopathy are the whole animal or the whole human. So this is why current conventional medicine is not set up to deal with homeopathy and what it takes to see and diagnose patients, because it's an hour to an hour and a half initial consult, right? And at least that if you're talking about a chronic illness. So it would be a completely different change, which is why working together is absolutely the best solution. I also want to address diet here a little bit. because I think we'll agree that a pet comes to you, and if they're being fed kibble, it's going to make it harder for what you prescribe homeopathically to do all it could do if the body isn't getting the kind of living food that it needs to thrive.
Mm-hmm.
So talk a little bit about that.
Well, I used to just think it was homeopathy that has a saying obstacle to cure, but it isn't. Obstacle to cure is, I would say, in every single medical modality, because if there's something preventing the body from healing, it doesn't matter whether it's homeopathy or even conventional, it's not going to heal. So food is definitely a big player. Stress is a huge player. Animals, in my opinion, this is a little controversial. It's okay, Henry. But what happens is that we have free will, right? So we can choose whether we want to eat food that's processed or we want to go and try to eat live food. We have a choice if we're bored, especially with COVID or something, you can watch a movie, you can do an online course, we can keep our brains active, we can work out in the house, we can do yoga online, we can do so many things where animals can't. So I think there's two big reasons for animals not getting cured. And that is, one, diet, because nothing can thrive on something that's void of real nutrients.
Yeah, it's dead food.
The dead food. Right? We know that with people, it's no different. A cell is a cell. If a cell is going to become depleted or oxidized or whatever in a human, it's going to happen to a dog, a cat, a pig, a horse. It doesn't matter. So 100%, if we're not feeding them a species-oriented food, if we're feeding food that's a dead food, or we're feeding foods that have been excreted and then synthetic vitamins and minerals be put back on it, we know that synthetic vitamins and minerals can actually cause oxidation. So for sure that, and the fact that animals, I don't feel, get enough time and attention, they don't get enough exercise, they're not allowed to be loud and obnoxious and bark and smell each other's bums, people pull their collars away. Like, we really don't let them be animals. We want them to be too human. Right. And I think that causes a lot of disease or ill health or prevents stress. Yeah, for sure. So I think and the fact that we're spaying and neutering them, right? So we're removing their sex hormones at such a young age. It just can't help but do some damage. Yes. So when we look at dogs and cats, they just have so many layers of ways that we need to approach and look at in order to get curative results or make them have the best quality of life that we can give them. Mm-hmm. And, if we can't give them raw, or because often I would have families come in and some people would want it, like one member of the family wants to do raw, the other member of the family doesn't, and it becomes this massive debate within the family. Well, that stress alone isn't good. So it's really finding a balance and then adding what you need if you can't do what you think is the perfect solution, right? There's no perfect.
Absolutely. Now, we are learning more and more how critical the gut microbiota is, that balance for humans and for animals. How important have you found the gut in solving illness in dogs and cats?
I can't even put words to that. It can't happen unless you do it. That I can say. I mean, it's fundamental to health. I mean, you could feed the best diet in the world, but it's the bacteria that creates the metabolites that makes that carrot turn into a vitamin, right? So if that bacteria is not in there, your body doesn't even have the ability to produce the metabolites that actually gives you the micronutrients. So from like a nutritional point of view, it's absolutely vital. From an immune system, it's more than 80% of their immune system. We have the gut-brain axis. So for emotional health or aggression or timidity or anxiety, it's all related somewhere in the gut. Doesn't mean that there's not environmental issues as well going on, but the gut is predominantly the driving train to everything. Hormones, like I said, brain, emotions,
I think people don't realize how many important, I'm struggling for the word here, are located in the gut that we think most are located in the brain, but they're really located in the gut. Receptors. I mean, what's the word I'm looking for, Julie?
Metabolites, receptors, accesses. They say, it's so funny when like your gut sense.
Yes.
Right? Well,
yes.
your gut, it literally is called the gut-brain axis.
Yes. It's the vagus nerve.
Yeah. So there's a difference too between your brain and your mind, right? So your mind learns things, and a lot of stuff that it learns is inaccurate, or it holds on to things that it doesn't need to hold on to anymore.
Right.
Whereas your gut is basically trying to help you follow the real path and not what the brain has conjured up.
Mm-hmm.
Right. So, when you say brainwashed, it happens all the time. People can get brainwashed, and people will say, yeah, you know what? I had a gut sense, right? I had a gut sense. Well, that came from something. It came from your gut creating the communication to the brain in order for you to make correct decisions. And yeah, it's phenomenal. We know that serotonin and dopamine and all of the hormones, we don't have a balanced ecosystem, or the animal doesn't have a balanced ecosystem. That whole hormonal system is not going to be functioning how it should be.
Absolutely. So critical. We are going to take a very quick break here from our sponsors, but don't go away, because when we return, you're going to find out more of Julie's go-to practice for sick pets. So refresh that beverage, get cozy, and we'll be right back.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There's no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms. And our live radio stream goes out to over 250 million subscribers on iHeartRadio, radio.com, TuneIn, Stitcher, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back. If you've just joined, we're here today with Julie Ann Lee of Adored Beast, and one of the early proponents of holistic medicine for animals and people. Julie, why is homeopathy one of your top go-tos for pet care?
Homeopathy is very near and dear to my heart, obviously, because, I've worked with more than 35,000 animals. Wow. And not one of them I didn't use homeopathy on some level. So that question has to be followed why it's equal. The fact that it's so profoundly important in our lives is exactly why it is so risky for the sort of big pharmas and conventional mindsets.
Absolutely.
Because I honestly believe that if any of the holistic medical modalities out there could replace the majority of conventional medicine, it would be homeopathy. So I'm talking about antibiotics. I'm talking about things for anti-inflammatories, anti-anxiety, lots of the antis, yes. And really, like I said before, for, really acute trauma. My one clinic, we were a very integrative practice. We had surgeries, we had scopes, we had ultrasounds, we had physio, we had rehab, it was a very big integrative clinic. And I remember one time this little dachshund came in and had been stung by a bee, and it was in an anaphylactic situation. You couldn't even see this pup's eyes. Its nose he looked like a pug. That's how big his nose was, and he was blue. And all the technicians were running around looking for the crash kits, and everyone was getting ready to be giving him epinephrine and the whole 9 yards. And they put him on the table, and I just ran and got like apis and aconite, and I just started dumping it in my hands. It sounds ridiculous. And then spitting on my fingers, and then rubbing it in and just rubbing it in his gums, and then putting it on my hands and rubbing it in and rubbing it into his gums. And you literally could see this dog's, before they even got it in him, he started being able to breathe easier.
Wow.
The
That's
owner
fast.
was like, it was really fast. Like, would I have not given him the epinephrine? No, obviously he needed everything, but that's how fast it can happen, especially with things like I said, with shock. So homeopathy is a modality of medicine that can go with everything, and it can either work as a standalone, it can work as a life-saving support along with, it can work along with surgeries. It can help the pet. Like, all of our animals got, when they came out of being spayed or neutered, if they were having a surgery, they were, they got Reiki and homeopathy, and you would not believe the difference of these animals waking up. It's pretty incredible.
It's exciting. Homeopathy is a very elegant modality because of the way it works. I mean, you get the remedy right, and the fact that it triggers the being to heal itself, it's incredible. I mean, it's worked for me. I had a year-long illness, and I am healed, and I'm no longer food sensitive. And I was food sensitive my whole life, even before this year-long bout. It is just, and I've seen it with my animals. It's just a very elegant, powerful, yet gentle practice. And I mean, I'm passionate about it too. So
I think its biggest downfall is actually, believe it or not, it's practitioners, because homeopathy can be very campy, meaning that there's the strictly,
yes, strict single remedy homeopaths who are just very,
yes, yeah. And then there's Hahnemann, Kentian, whatever you want to call them. Then there's homotoxicology, then there's combination remedies. And again, everybody should be working with each other to support each other. And if somebody wants to have classical homeopathy and you don't do classical homeopathy, then send someone to that, or vice versa. Because I can tell you that with animals, the difference is that animals' recovery and cellular turnover is much faster than a person's. That's why they don't live as long. And when you're working with them or you're treating them, they're a lot like children, like babies. They can get sick, and they can get sick fast. You don't have time to sit and watch and wait. And you don't have time. You don't have the ability to communicate with them to the point where we can with people, right? So with my experience with it is that we have to work with it differently. We have to work with it differently than we do with people. And once they're stable, that's when the classical piece comes in, and you can get really incredible results. But initially when you come in and a dog has been on atopica or prednisone for 3 years, and it's got it's just its guts trashed, its skin is trashed, its mental emotional state is trashed, you can't just take them off of all the drugs and give one remedy, watch, wait, and see.
Oh my God, no.
It's not fair. And I think that I've seen more veterinary homeopathy fail that way, because it's too hard on the animal. So it's a different way of practicing, right?
Yes, it's very animal sensitive centric. But along those lines, what would you advise pet parents regarding learning homeopathy for acute common illnesses, treating acute common illnesses in their pets at home?
Yeah, there are some, I would honestly say, to do a child's, it's a kind of a longer way around. I would learn, there's lots of different programs online to how to treat your children. So for ear infections, coughs, colds, vomiting, nausea, things like that. Because there's more information, and it's more detailed, and it's deeper, right? Because it's been around so much longer than animal homeopathy. So then I would do that, and then I would really learn your diseases, right? I would do another course on how to recognize diseases in your dogs and your cats. And then you just literally, you combine them. You look at, okay, so croup in a child.
Yeah.
What would croup look like? Bordetella or kennel cough. It's
Yeah.
very, very, very similar. Doesn't
Yeah.
have to be the exact same virus,
Yeah.
but the symptomatology is very similar.
Right.
There's a really good book, if people can get it. It's called Morrison's Desktop Companion. And it's for people, it's for families, but it's very clear. The symptomatology is really, really clear that you can, if something's got a green discharge coming out of its nose, it doesn't matter if it's a dog, cat, horse, or animal or person, it's a green discharge coming out of its nose. So I would tend to stay more with the family children because they do tend to repeat remedies more often, which you do have to do with dogs and cats. You do have to, in acute situations, you do have to like, you can't just give one remedy. It's the same with children. If a child's sick and it has croup, they don't just tell you to give one remedy and sit there and wait. It's usually give it every hour for the first few times. That's that sort of thing. Right. So I would try to look at children and then learn about animal diseases and then just combine them. To me, that gives you a deeper dive and more success.
Okay, thank you. That's great.
Don Hamilton has a really good book.
Yes, he does.
Don Hamilton.
Yes, he does.
I just love him so much.
Yes, he does.
His book is really, really good.
How effective have you seen homeopathy be in, let's say, serious illness like cancer?
I have a kitty right now that has tumors, very bizarre tumors too, that, they gave her maybe 3 months. All the board certified oncologists and stuff gave her about 3 months, and it's been 6 years.
Oh,
so
my gosh.
I have more cases. I think I have more cases of cancer that have way outlived their prognosis. But what is really, really, really more important, am I ever going to say that it cures cancer? No way. But what it does is they act like they don't have it.
Explain that a little bit more.
They live with cancer. They live with the tumors. The tumors might get smaller. Do they completely go away? Not always. They don't always completely go away. They rarely completely go away. But they'll shrink to a size where it's not, the animals are acting like they're not sick.
Their vital force is
Their
strong.
vital force is strong. They're running around. They go to the park. People go, there's no way this dog has cancer. There's no way this dog has lymphoma. There's no way this dog has this or this cat has this. And they don't have the side effects of the drugs, right? So it's a fine line to walk. And my heart goes out to a lot of people. But I honestly have to say that in my practice, I would say that I get equal, if not longer, prognosis than with drugs, but their quality of life, you can't even compare.
Yeah.
It's way, way, way better. Way better. I did a cancer lecture and I showed, I don't know, there was like 600 people there, and I showed x-rays of tumors and x-rays of all kinds of different things. And people were just blown away. Like, really, that dog lived for 5 years with that tumor in there? And I'm like, yeah, it did, because we got it to a point where it was not invading on anything that was causing it any distress.
So exciting. How important is the mindset of the pet parent in approaching their pet's health holistically?
Very important.
Yeah.
Very, very important.
They need to be open.
Not just open. They need to understand that it's a journey, right? It's not, I always say to people, if you're waiting to go get something and take a pill and give your dog or cat a pill,
which is what
and
we're
then
taught,
walk away and not pay attention, then holistic, anything, homeopathy, doesn't matter. It's not for you, because it's not what it's about. It's about the commonality. It's about the connection. It's about paying attention, being mindful, being present. Oh, wow. Yeah. Like, its eyes aren't tearing anymore, or there's just even subtle changes that we miss. because we are too busy, we're too consumed with something else. We aren't taught to pay attention to our own bodies, to our family's bodies. We're not taught to pay attention to really vital things that show disease coming or show disease going away. We ignore it until we're really, really sick, or until the animal's really, really sick. And then we want a quick fix that we can't even go, yeah, you know what? He is sleeping back where he used to sleep. Because you take detailed notes, right? And people come back and say, I don't see much of a change. I'm like, okay, so is he still sleeping, downstairs behind the couch? But no, he's not. He actually is sleeping back upstairs. Okay, awesome. Is he still can't get up the stairs? No, he can get up the stairs now. We're so busy, we're not even noticing the symptoms that we know that are changing or not, right?
Yeah.
And symptoms, people have a bad connection with symptoms. Symptoms are really important. So treating symptoms is very, very important, because you're treating them, you're not suppressing them.
Right.
So a symptom is
They're our friends.
They're our friends. They're the language of the body.
Yes.
So when we treat them, the body's going, thank you. You heard me. You saw me.
Yes.
But when we suppress them and we just push them down, they go to a deeper disease.
Exactly. Julie, thank you so much. Is there anything else that you'd like to share today? This has been great. Really.
No, other than don't be intimidated by it.
Good.
Don't be
important.
For people that are out there that are just, I really believe that our animals are our guides. And sometimes we are scared to take the step in looking at being healthier, but we will want our animals to be healthier, right? So we start looking, but then it gets a little intimidating. Start where you can, pay attention, be more present, get more connected. And even if you do 10% of a difference, but you're more connected, more present, and just more there with your animal, it's going to get better.
Absolutely. Absolutely. Where can people find you and Adored Beast?
AdoredBeast.com.
Okay.
Yeah. Or we've got lots of videos we have a YouTube station, Adored Beast Apothecary.
All right. Thank you so much for sharing your wisdom today, Jules.
You're welcome.
Really appreciate it. And thank you all for listening. Thanks to our producer, Mark Winter. Mark makes us sound so good.
He does.
He does. My passion is living stylishly, animal rescue, and health. A mouthful, I know, but if our dogs or cats look great when they're wearing something really stylish, but they don't feel good, what good is that? So health is super important, and you'll be meeting more health and wellness experts on my show in the coming months. So also you can visit me on a new site called thehoundhealer.com for more stories on natural health and wellness, great tips for pet parents. So until next time, when fierce fashion calls, bark and swagger.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.